and more. Thank you for being with us tonight on this special edition of 60 Minutes. Dr. Jennifer Green, along with 2 other American citizens, will be with us tonight as we take a closer look at America's devastating reaction to this epidemic.
Thank you for inviting me. It's great to be here.
What do I think? End. This is the end. What is the government gonna do? We use water every day. We use it to drink, to cook, for the crops, we're crying out loud. Water is life. What are we gonna do without it? What is the government gonna do? Can you tell me that? What are they gonna do? I'm afraid.
Yeah, I remember getting that phony boiled water nose in the mail a few days ago, but I didn't pay it no mind. I've been drinking this water for over 30 years now, and ain't nobody gonna tell me it ain't safe for drinking. By way of terrorism, who ever heard of such?
Dr. Green, obviously our nation is in trouble. So what exactly is cholera, and what are its symptoms?
You're right, Cynthia. Our nation is in a great deal of trouble. Let's take a closer look at cholera. Cholera is caused by the bacteria Vibrio cholerae. This bacterium lives in your intestinal lumen and secretes a toxin that actually enters the cells of your intestines and causes an increase in the secretions of vital fluids and electrolytes. Because of the increase in secretions of these vital substances, the patient normally experiences vomiting and diarrhea, which can and usually does lead to severe dehydration.
Interesting. Well, we called to identify the impact that cholera has had on Maria's hometown in Fresno, California, only to receive devastating news.
Me siento mal. Me siento muy mal. Fui al doctor, and he looked at me scared out of his mind. Many of my friends have fallen very ill. Some of their children have died. He tenido mucho vómito. I've been vomiting and been very sick. The diarrhea started lightly and has gotten worse. I am very afraid. No me quiero morir. No quiero.
So, Dr. Green, I guess the number one question on all of America's mind is, once infected, then what?
And that's a great concern, Cynthia. In my expert opinion, cholera's main virulence factor is dehydration. Therefore, it's extremely important that an infected patient stays hydrated as much as possible, even if this means seeking out IV fluids as therapy.
Let's listen in now to a disturbing voicemail we received here at our studio last night from Jolene in Texas.
Hey, this is Jolene again. I'm just calling to say I should have listened to y'all. Fluids have been rushing out of me like one of those geysers at Yellowstone Park. I can't keep anything down, including the delicious turkey stuffing my neighbor Steve made for me a few days ago. Worst part of it is, all my critters are dying off too. Even my poor dog, Charlie Brown, kicked the bucket just last night. All in all, I just want to say that this is serious as a heart attack, people.
Wow, that is heartbreaking. So, what is being done to control this outbreak, and what can Americans do to help?
It's true, Cynthia. It truly is heartbreaking. The government is working overtime to combat this bioterroristic strain of cholera. We've doubled our efforts into testing and treatment of our water facilities, and in addition, we've also increased the amount of MRE packets substantially. However, citizens in general can aid in efforts as well just by practicing good hygiene, and this just means washing hands and boiling their water when notified.
Thank you, Dr. Green. Well, that does it for tonight. America, remember, our future is in your hands.